one. I hope everyone can hear us. We are going to start the webinar on completing the PSC assessment. My name is Consuelo Gambino. I am the program specialist for the ACORNS program. I'm going to start off hosting the webinar. We also have here in the room Andrew Stepman.
Hello.
He is the program evaluator for the ACORNS program, and Virginia Hedrick is also here, the program manager. So let's go ahead and get started. Okay, so some of the Phase 1 deliverables for Phase 1 of the ACORNS program is completing the community health assessment, which is the change tool. Everyone will be required to complete the About Your Community survey. The change tool that we have here is the Adapted Change Tool by CRIB. It is more tribally focused. So after you complete the About Your Community survey, you'll be required to complete 2 additional surveys. You can select one from the list here, the community at large, the worksite sector, the healthcare sector, or the school sector. And then after you complete these surveys, you'll be required to complete the community action plan and the final report. I have everyone on mute right now just so we can block out some of the background noises. If you guys have any questions, just go ahead and type in your question. This is the timeline for over the next few months. The surveys will be due June 10th. After you submit your surveys, we will be sending out a PSC snapshot no later than June 17th. The PSC snapshot is an overview of the challenges and strengths in your community. It will be based on your completed surveys. It will indicate your community's high priority indicators, your high priority areas. And the PSC snapshot will also help you complete the community action plan, which will be due July 22nd. And the final report will be due August 31st. We are here to help you the whole way. Stacy Kennedy is our principal investigator, and everyone I'm sure pretty knows Virginia Hedrick, which is our program manager. Andrew Stepman, our program evaluator, myself, the program specialist, and we also have Chris Cooper, who is our tobacco specialist here. So Phase 1 awardees will first assemble a tribal community team. Some have done this already. If not, this is the first step. You'll gather information on your community and produce the community health assessment, and then onto the community action plan, which will address policy, systems, and environmental changes. The community action plan will be aimed to address one of the following, which is tobacco use and exposure prevention, physical activity, healthy eating, chronic disease prevention, and related risk factors. So you will select one of the following or more. The tribal community team is meant to answer assessment questions as a collective. The community team should be key decision makers in your community. Let the team know the purpose of the survey is to have a snapshot of the policy, systems, and environmental in your community. So the tribal community team could be one of the following. This is an example of people that you can select. Someone from Head Start, Tribal TANF, a tribal member. If you have, if you're doing the school site sector, maybe someone from the school. It's just going to be who you want to represent to help collect data and make important decisions, key decisions. So now we're going to move on to the community health assessments. And I'm going to let Andrew Stepman take over, and he's going to go over the surveys and the change tool.
All right, thank you so much, Consuelo. Good morning. All right, what we're going to do is proceed with actually walking through some of the surveys. So, as Consuelo mentioned, and you saw in the RFP, one of the surveys is required. So yeah, we'll just touch upon the slide before we look into the surveys. But as Consuelo mentioned, we're going to host. We suggest hosting a tribal community team meeting. So prior to the meeting, providing every team member with a PDF copy of the surveys that we will furnish for you to complete. So in completing the surveys, we suggest having the tribal community team, the TCT, in a room, projecting questions on the screen, answering the questions collectively, taking note of any differences, and if a decision is not reached, adding information on your notes, and then emailing Consuelo, myself, or Virginia. You could send it directly to me. That would be wonderful. I do have my contact information on the surveys you'll see. But if there's any differences and if you have any conflict in trying to answer one of the questions, please feel free to directly contact me and can provide some insight to move forward. And basically, the overall goal of these surveys is to gather information to support the development of your action plan. So the implementable strategies for the community action plan to address policy systems and environmental changes for your chronic disease prevention and management efforts. All right. So you will see the SurveyMonkey. We will send you'll see the SurveyMonkey links to the surveys. We'll send them in an email directly to you, the contact person who we've been provided with their information. So all of the surveys will be in one email, and again, you're required to complete the About Your Community survey and then a minimum of 2 of the sector surveys. So without further ado, let us proceed with going through the surveys. So, all right, so the required survey, which we will start with, is as you can see my cursor, the About Your Community survey. So let's start with that one. Fantastic. So again, these links. Okay, one more, please. We're gonna share the screen. Okay. Fantastic. All right. So this is the. I did click the link, so now you see the About Your Community survey. So the links on this slide are preview versions. You will receive in an email the actual version. So there are also PDF versions on the ACORNS website for your perusal. Basically, the PDF versions of the surveys that we were recommending that you print out to have as an assistive device when completing the surveys. So again, this is basically the final version of what you will be seeing. Well, it is the final version, just one that you can't complete. You will receive the final version, the one that you could actually fill very, very shortly, perhaps today, if not in the very, very, very near future. So let us begin. So the About Your Community survey. You will see all the surveys begin with an introduction page. So I'm going to proceed with reading this through for you. So thank you for taking the time to complete this About Your Community survey. The purpose of the survey is to provide a snapshot of your tribal community, inform policy, systems, and environmental strategies focused on preventing and managing chronic disease. Your responses will help guide the CRIB ACORNS team's collaborative assistance to your tribal community's chronic disease prevention and management efforts. Also, the blue underlined phrases. The purpose of the survey is to provide a snapshot of your tribal community to inform policy, systems, are clickable links providing further information. So wherever you see a blue underlined phrase, it's something you can click and it will directly open up a new window providing information for you to complete the survey. So this one, it was actually a little finicky, so I might have to open in a new tab so you can see. There we go. All right, so this is the result of clicking the first blue link. You'll see the change tool portion on the ACORNS website. So basically, it has a bit of information regarding the your community and defining your tribal community. So let's get back to the survey. All right. So I do have the instructions. Click the next tab below, next button below to move to the next page. So we've read the instruction and we're ready to jump in. Next. So the instructions for completing. For the following questions, please provide responses that best describe your tribal community. You can edit your responses from any computer at any time, even after submitting the survey. The survey will automatically save responses after you complete a given page and click the next button or the done button on the final page. You can return to your survey by following the unique link originally sent to you to your email. So in completing this, this about your community survey, we are asking that you provide basically what sources you are using to answer the questions. So that's what this paragraph is getting at. Below are 4 links to public secondary data sources. For detailed information on these data sources, please see the data section on this ACORNS website. And again, you probably see a lot of underlined blue sections, so those are areas that you can directly click. So I'll click on that one right now. Data sources brings you directly to the data sources, secondary sources portion of the website. You can scroll down and it has much of the information that you'll see when you get back to the survey. So let's get back to the survey. These data sources are optional, as you may use a community survey or other data sources that are most applicable and reliable. Please take note of the data sources you use to complete the survey, as you will be asked to share this information. So here are the 4 data sources, and again, they're all clickable. So you'll be able to use these at your leisure, or use your own community survey or other data sources. And again, if you need any assistance or have questions, please contact me, Andrew Sutton, ACORNS Program Evaluator, and here's my email address and telephone number. So don't hesitate at all. Navigation instructions. To move to the next page, click the next button. To return to the previous page, click the previous button. And again, when completing these surveys, everything, all your responses on a completed page should save once you click the next button, which means you can, if you wanted to go back, you could always click the previous button and it should save and allowing you to revert back if you wanted to check your choices or for whatever purpose. But we do encourage you to complete the survey, and if you have any questions, directly contact me. So let's move forward. Okay, so on all these surveys, you're going to see this page as well. So agency and contact information. Basically, this is so we know who's completing the survey. So information we're asking about your agency and who is the individual completing the survey. So more or less, all of the fields on the surveys and all the questions are required, which means you need to provide an answer. And in the event that you don't provide an answer in any field or question, you'll receive a pop-up box indicating that you, or pop-up note that you are to complete, where there's a missing answer that you need to provide. So also, I'll show you what that looks like. Clicking the next button on a page that does not have answers will result in, oh, this question requires an answer. So just a little reminder asking you to provide that information. So let's go ahead and fill out this page. And again, we want you to be explicit and detailed about your agency, but just for the purposes of completing this, I'm going to just general information. Agency tribes, agency name is the first box. Tribes represented, the tribes agency is representing, name of the health officer, street address of your agency, city, state, California, zip code, and your telephone number. That's for the agency. And as we go below, we're asking for the agency representative completing the survey. So such an individual's name, email, and work telephone number. Fantastic. We've completed this page, and we'll move on to the next one. Wonderful. So now we're actually getting into the questions of the About Your Community survey. So first question, how do you define your tribal community? Your definition of tribal community will guide your answers to questions in the ACORNS Phase 1 surveys. Please visit the ACORNS website Change Tool section for additional details on how to define your community. So this is a clickable link, and we'll click this link. And again, the Change Tool portion of the ACORNS website, scrolling down just a short bit, you will see a portion on community, and some guidance in defining your community is located right here. So not very far down on this page, as you can see. Wonderful. So let's get back to the survey. So you'll provide an answer in this box, and this, again, for the purposes of completing, for this demonstration, I'm just going to put answer. But we want you to obviously be a bit more detailed. But fantastic. So next question about community density. So what is the approximate number of people who reside in your tribal community? You'll provide a number. So I'll put number. What is the approximate size of your tribal community in square miles? So number of miles. Next question as we continue to move down. Do you currently have a tribal community team TCT formed? Please select one of the following choices. And again, we see a blue underlined link, which means it is clickable, so let us click. And it's going to bring up a PDF file on the ACORNS website, directions for your tribal community teams. You may have received this, but just has detailed guidance for the TCT, as Consuelo did mention how you could form your team and the members we would like you to have on that team. Up to your decision, but key decision makers in your community will help guide the ACORNS project. So let us get back to the survey. This is a multiple choice question. As you can see, the multiple choice answers. And also, as you see, there will be some questions that have an other. Please specify. So wherever you see an other, if you click this box, you will have to provide a description. And if you don't, then you will have a pop-up message to please provide details of what the other means in with your ACORNS program. So let's say that you did have you do have a TCT forms and have met at least once. All right, let us move to the next question. Who is included in the priority population of your tribal community? This population is the focus of your chronic disease prevention and management efforts. For example, patients served by the clinic, people living within the service area, tribal members, high-risk individuals, etc. And I believe, yes, when we did click the prior link, the tribal community team, which is this tab, which I'm going to click in this moment. I apologize. There's the prior blue link, which was the ACORNS website, and it does have some definitions regarding the community and the population. Okay, let us get back to the survey. So you'll describe your priority population in this box. Priority population. Wonderful. Okay. So next question, what do you consider to be the hub of your tribal community? For example, geographically, such as the tribal office, health clinic, community gathering clinic, etc. So then you'll provide a description, hub of tribal community. Next question, does your community have a tribal health clinic? Please select one of the following choices. As you can see, choices. If you're defining your tribal community as your tribal health clinic as a community, then that is an answer we have provided. We want you to select the most appropriate of the options. Move forward. Next question. Where is the nearest hospital that typically serves your tribal community? Please select one of the following choices. Again, we have a series of choices. Select the most appropriate one. Next. Does your tribal community have public transportation? For example, shuttle rides, bus, etc. Please select one of the following choices. So yes or no. And if you do provide the answer of no, please specify approximately how many miles away the nearest bus stop is outside of your tribal community. Okay, as you can see right now, I'm actually not going to place an answer in this, so that just for the purposes of being able to get back to this question, there's a clickable answer choice that has a box, and you don't provide an answer, you'll have a reminder. So we'll get back to that in a moment, just a little reminder. Next question, does your tribal community have a farmer's market or fresh produce stand? Again, we have several answer choices. Select the most appropriate one. As we continue down further, does your tribal community have a community garden? No or yes. In this yes answer is the one that requires a bit more detail. So the yes answer, please specify the number of households that accessed food from the community garden during the most recent harvest season. So you had 50 households. We'll put that number. Next question, how many grocery stores are in your tribal community? Please select one of the following choices. Next question, what is the appropriate percentage of people in your tribal community who use commercial tobacco products? Then you'll put the approximate percentage. Does your tribal community have a drug recovery group such as Narcotics Anonymous, Red Road to Recovery? A yes or no answer choice. Next question. Does your tribal community have an alcoholics recovery group such as Alcoholics Anonymous? Yes or no. Next question. Does your tribal community have a support group for family and friends of those using or in recovery from using alcohol or drugs? Yes or no. Next question, a fillable one. Which 3 organizations or companies employ the greatest number of Native Americans in your tribal community? So we're asking you to provide the name of the 3 companies. If you don't have, if there aren't 3 companies that employ Native Americans, then you could always put not applicable, but if possible, please provide the name of the companies. So company 1. Company 1. Oops. Company 1. Company 2. And company 3. Next, what is the median annual household income of your tribal community? Please select one of the following choices. As we can see, there is a clickable link. So, clickable link, let us click. And we do have a website that provides a bit of information regarding household income in areas in California, as well as the country, but this might provide some guidance in providing the answer to the median in household income. And median household income is referring to this, suggesting that the median is the halfway point in that there's half of the values exist below the median and the remaining half exist above. So just to sort of average as opposed to a mean or mode, which mode is the most common, most frequent of values, but median is. So say you had five values of ascending order of household income. So it was 10,000, 15,000, 20,000, 25,000, and 30,000. A third of the fifth, since there's 2 values below and 2 values above, would be the median. And I believe I said that would be 20,000. So half the values below, half the values above the median is the middle value. Okay, let us get back to the survey. So select the most appropriate answer. Next, what is the approximate percentage of people in your tribal community who are living in poverty based on federal poverty guidelines? Please select one of the following choices. And as you can see, we have a clickable guide. And let's click and see what this is suggesting. So it actually provides the 2016 federal poverty guidelines for the 48 states. So this will apply to California, and here are the values you can use to guide your answer. All right, let us get back to the survey. Okay. Next question. Nearing the end of this page, what is the age distribution of your tribal community? Please, percentages of the following age groups comprising your tribal community. So we're asking for the age profiling of the different age groups in your community. So we're going to want you to provide percentages for each of these age groups, age brackets, if you will. So specific percentages. Next question. Actually, the last question on this page. So what data sources did you use to answer the previous questions on this page? As you recall, on one of the first few pages of the survey, we were asking you to record your data sources, and well, basically this is one of the examples of where we're asking for that information. So select whichever data sources you used, and if there was an other category, another that we didn't cover here, please put that information in and share it. All right, so we appear to have completed this page, so let us click the next button. Oh, as you may recall, I did skip, sneakily, I did skip one of the boxes. So just showing you, if you don't answer one of the required comment boxes, then we will ask you, I will require that you put in some information. So again, this is getting back to the does your tribal community have public transportation? So we selected no, how many miles away, so we will just provide miles, number of miles. Wonderful. So now we appear to have completed this page. So let us proceed to the next one. Next. Okay, so now we have a few more questions on this about your community survey. I'm asking for specific information in the specific data sources. So this first one is on unemployment. What is the approximate percentage of people in your tribal community who are currently unemployed? So your answer choices. And then following question, what data sources did you use to answer the question immediately above regarding unemployment? And again, provide whichever source you used to answer that question. Next, we have a very similar page right now, but on diabetes. So what is the approximate percentage of people in your tribal community who have been diagnosed with diabetes? So this could be all diabetes, type 1 and type 2. So you could specify if you wanted the percentage of type 1 and also the percentage of type 2. That's why we provided you with a box, so you can provide as much detail as you have. So then you'll provide that information. And the following question, asking what data sources you used to answer the question on diabetes, diagnosed with diabetes. Wonderful. You answered these two questions, and we'll click the next button. Next question is on overweight. So what is the approximate percentage of people in your tribal community who are overweight? And we do have a few clickable links right here. And these links will go to the CDC's website, Defining Childhood Obesity. So childhood obesity, it's actually obesity and overweight. CDC had a little bit of a typo, but it's, as you can see, overweight and obesity. And overweight is defined for children as a BMI at or above 85th percentile. And going back to the survey, there's also a link to the CDC regarding adult overweight. And here is that link, and it has guidance as to what overweight means within the adult population, as you can see. Here's the information. All right, we go back to the survey, so we could answer approximate percentage. And if you wanted, if you had the data, you could break down by children and adults as well. Provide as much detail as you can. That would be wonderful. And then providing the data source or sources used to answer the question. Next question. We're actually asking about obesity. So we asked about overweight in the last page. Now we're asking about obesity. And as we can see, we do have the same links from the previous page, as the CDC does have a page on both obesity and overweight. So for children, obesity is defined as a BMI at or above the 95th percentile for children and teens, the same age and sex. And going back to the survey, the clickable link for adult obesity has guidance just the same on this page. Here it is. If your BMI is 30 or higher, falls within the obese range, and the BMI or body mass index is a specific calculable amount based on person's weight and height. And there's a calculator CDC has on the website you can use to help guide your answer. Let us get back to the survey. Then providing, again, as much detail as you can regarding obesity, so it could be by adult and then children, providing that information, and then providing the data source. So what data source is used to answer the question. Just so answering and then moving forward. And nearing the very end of this survey, what other phase 1 surveys? Basically, we're asking you to provide that information. Which other ACORNS phase 1 surveys do you plan to complete? Please select all of the following. And again, we're asking you to do complete at least 2 of the sector surveys. So what if you only select 1? We've asked you to select at least more than 1. We've asked you to select 2 or more. So you select one and click the next button. What's going to happen? You need to select at least another one. So whichever 2 or more surveys you'd like to complete as part of your community health assessment, please indicate that here. So if you're going to do the community at large and the school site sector, select those and move forward. And then we've reached the final page of the survey, the complete page. So please share any additional comments before submitting the survey. And this is an optional comment box, but please share any comments. And then you're going to click the Done button to submit the survey. We can click the Done, and that is the end of the preview. Wonderful. So let us get back to the.
Click the link on the right.
Click on the right.
On the right screen. You're going to click on that.
Yep. This one.
1 or 2 if you want them to see your.
We're just getting back to the the survey. I hope we can all see this troubleshooting. Just one brief moment. Just going to get back to the survey. Fantastic.
That shows your vacancy.
Okay. Appreciate it. Thank you. All right. So actually, what we're going to do now is just go through one of the 4 surveys. All of these remaining 4 surveys, again, at least two of which you're required to complete, are very similar. They all have both multiple choice questions and the PSC specific questions, but for the purpose of this demonstration, we're going to select one, as they're all very, very similar. So let us select the community at large survey and go through that one. Okay, so just one moment as we can see. Wonderful. Okay. So now we're looking at a preview version of the community at large survey. Here it is. Okay. And you are going to see a very, very similar introduction page to the very similar as the about your community survey. Again, I've designed these surveys so they seem very very much the same, so you're not having any surprises. We're all fairly straightforward. So the introduction page is just the same. Thank you for taking the time to complete the survey. The purpose of this survey is to provide a snapshot of the policy, systems, and environment, PSC, conditions that may influence chronic disease in your community, in your tribal community. And again, clickable link. The community at large sector includes community-wide efforts that impact the social and built environments, such as improving food access, walkability, bikeability, commercial tobacco use, and exposure or personal safety. So the difference between the community at large survey and the other remaining 3, the healthcare sector survey, the school survey, school sector survey that is, and the worksite survey is little nuances like right here. It'll define what those sectors entail, but you'll be able to see those when you complete the surveys that you do choose to complete. Your sponsors will guide the ACORNS team's collaborative assistance to your tribal community's chronic disease prevention and management efforts. And again, a description of the blue underlined phrases providing clickable links, and then clicking the button below to move to the next page. So let us move forward on this community at large survey. And you're seeing the instructions once again. So please provide responses that best describe your tribal community. You could edit the responses, such and so forth. And if you need assistance, I have my contact information is right here. So again, don't hesitate to contact me for any clarification or any questions. Then the navigation instructions below. So moving forward, the next button, and to move back is the previous button. So let us move forward. Next. And again, you're going to see on all of the surveys the agency and contact information we are asking you for, so we could identify who's completing the survey. So agency, the tribes that your agency serves, the name of your health officer, or name, street address, city, state, zip, telephone number, and then the name and contact information for the agency representative completing the survey, name, email, and telephone number, work telephone number. Wonderful, we've completed this page, and we'll click the next button. All right, first question on the community at large survey asking about your tribal community team, the TCT. So please list the names of the members on your tribal community team, as well as their community affiliations, such as a tribal leadership, school district, fire department, etc. And the clickable link. So if we were to click it, click the link, and you can see, again, the PDF to the TCT page on the ACORNS website. All right, let us get back to the survey. So we'll have you list the names. So name, asking for the name, and say, oops, name, tribal leadership, name, school district, etc. So basically providing the name and affiliation. Provide all that information for all of your existing tribal community members. And next. Okay, so now we're proceeding into the PSE, the policy systems, the policy systems and environmental questions on the survey. So this has a bit more detailed information in the instructions. Are a bit more detailed. Let's read through these right now. So the rest of this survey assesses your tribal community in the areas of physical activity, nutrition, commercial tobacco, and chronic disease management. For each of the above areas, there's a series of questions asking for both a policy and an environment response. Please use the following definitions as well as PSE guidance on the ACORNS website to complete the survey. So clickable link, let us click that and see where it brings us up to. So the policy system and environment PSE resources on the ACORNS website. So guidance, as I mentioned, you could read through this. Should help provide some guidance in answering the questions on policies and environment. All right, let us get back to the survey. So we have a description. Policies are the laws, regulations, rules, protocols, and procedures designed to guide or influence behavior. Policies can be either legislative or organizational in nature. So much of the same information as we just saw on the PSE website, a page on the ACORNS website. Description of environment. Environment is the physical, social, or economic factors designed to influence people's practices and behaviors. So we have the physical environment, structured changes, or the presence of programs or services, including the presence of healthy food choices, improvements in the built environment, and the availability of services to patients or workers. Social environment, a positive change in attitudes or behaviors about policies that promote health or an increase in supportive attitudes regarding a health practice. And environment improvement, it should be economic environment, I apologize. The presence of financial disincentives or incentives to encourage a desired behavior. So those are the definitions where you're using. And using the following policy and environment answer-choice scales, also provided here as a reference, clickable link. Please choose both a policy response and an environment response to all questions by clicking the drop-down list on the remaining survey pages. So as you can see, scrolling down just a little bit, we have the policy. These are the policy answer choices, and scrolling down just a bit more, we see the environment answer choices. So it's a bit to remember, as you may see. So right here, as I provided the link right here, here's a reference, the policy environment answer choices. Let's click it. So conveniently, here are those choices. I'm going to zoom out just a little bit so you can see. Wonderful. So this is, you may want to have this page open while completing the surveys among your tribal community team, or when you're completing the surveys. So this is something that will help guide those answers on the coming pages. So a description. We'll just briefly go through the choices. So policy, not an issue. The policy stated is not defined as an issue to key decision makers in the community. Identified as an issue. The topic has been identified as an issue. However, no strategic plan has been made regarding a policy action to address the issue. Plan has been developed to address the issue. Plans, action steps, have been developed to address the issue of concern. Action taken on issue. Measurable actions have been taken on the issue based on the plans developed. Evaluation and outcome of action. The action taken to address the issue is evaluated to ensure results are identified. or not applicable. The policy is not appropriate for this community. Then we have the environmental elements, the environment answer choices. So element refers to a component of the physical, social, or economic environment that is being reviewed. And the choices, not in place, meaning no elements are in place. Few in place, few elements in place in the environment, or approximately 1/3 of the elements that have been identified as need are in place. Some in place, some elements are in place in the environment, or approximately 1/2 of the elements that have been identified as a need are in place. Most in place, most elements are in place in the environment. Approximately 3/4 of the elements that have been identified as a need are in place. All in place. All elements are in place in the environment. All the elements that have been identified as a need are in place or not applicable. This type of environmental change strategy is not appropriate for this community. Wonderful. So we've gone through the answer choices. So you may want to have this, may want to print this document out, and/or have it open when completing the open in another window or tab when completing the surveys. So let's get back to the survey. So the answer choices, scrolling down, and let us move next page. Wonderful. So now we're getting into the first of the 4 areas. So physical activity, nutrition, commercial tobacco, then chronic disease management. And this is the first one, physical activity. So I'm actually not going to read through all of the questions because there are quite a few. But bear in mind that all of the questions, all of these policy and environment questions on the given surveys that you choose to complete are required. So for each question, you'll have to provide both the policy and environment answers. So we have the beginning portion of the question: to what extent does your tribal community, and for the first example, first question, provide public recreation facilities? For example, roundhouse, community park, a pool, parks, etc. So in answering the policy portion, you will use the guidance, that document, that page that we're just reading about the answer choices, to provide an answer about your tribal community in providing public recreation facilities. So these are the drop-down boxes. So the policy drop-down box, we will click and see the answer choices that I just read that you saw on the prior page. You will select the most appropriate question, most appropriate response to the question in the policy segment identified as an issue, for example. And then we'll also have the environment portion, environment answer required for the same question regarding public recreation facilities. So then you will provide an environment answer for this question. And then you will go down and provide all of the answers for all of the different questions. So parks, access to parks, walking routes, and so forth. So this is just the physical activity page, but they all do require answers. So for instance, we haven't provided an answer to all but the first one, and we click the next button. What's going to happen? This question requires an answer. So just for the purposes of this demonstration, I'm just going to select an answer for each one, but we want you to be diligent about answering the questions and give this thought within your tribal community team meetings and answering these the best of your ability based on the information you've gathered. Answering all of the questions on this first page about physical activity, nearing the bottom of the page, and we'll proceed forward to the next page. Good. So next page is the second area, nutrition. This looks very, very much the same as the last one, but specific questions about nutrition. So again, to what extent does your tribal community, as a prefix to the question, encourage community gardens, provide access to farmers markets, accept WIC, and so forth? So for each of these questions, again, required to provide both a policy and environment response. So then you will provide the most appropriate response for each of these nutrition questions. just providing an answer at this point for the purpose of the demonstration. We will shortly get to the next area of this community at large survey. Wonderful. The next area is commercial tobacco, the third area. And again, to what extent does your tribal community institute a commercial tobacco-free policy 24/7 for indoor public places? And institute a commercial tobacco-free policy 24/7 for outdoor public places. So there are slight differences between some of these questions, but all the questions are getting at a specific policy or an environment detail. So really getting at the existing baseline of your community, as it is. This is the health assessment we're using to inform priority areas and avenues for increased chronic disease prevention and management efforts within your community. So we're looking for this information to provide that insight. So again, providing a policy and environmental response for each of these questions. And then moving forward. I'm going to scroll down, and you can see on this page we actually have some additional questions, some multiple choice questions. So here we are. What is the approximate percentage of people in your tribal community who smoke commercial tobacco? Please select one of the following choices. Okay. Next, what is the approximate percentage of people in your tribal community who chew commercial tobacco? So difference smoking commercial compared to chewing commercial tobacco. Providing that answer. Next question. Do you see commercial tobacco being used for traditional purposes at tribal community events and ceremonies? Providing an answer. Next, is traditional tobacco easily accessible for traditional purposes in your tribal community? Yes, no, or not applicable. Then we have a checkbox question. Which commercial tobacco policies exist in your tribal community which currently have in place? Which commercial tobacco policies does your tribal community currently have in place? Select all of the following that apply. Then you have the other. If you select the other, then providing the description. Next, if the tribe or tribes you represent has a casino which best describes the casino's smoking policy, please select one of the following choices. Okay. Next, checkbox question. If the tribe or tribes you represent has a casino, which of the following methods apply to the casino's commercial tobacco sales? Select the most appropriate answer or answers. Nearing the end of this page, another question. Which of the following does your tribal community have regarding commercial tobacco sales? Please select all of the following that apply. All right, and select all that apply. Wonderful. We can move to the next page. And next page is on chronic disease management, the fourth area covered by this survey. Again, a series of questions asking for both the policy and environment response. So go ahead and provide those answers for this chronic disease management page. Making progress. There's a later segment that is asking about the decision makers. To what extent do the decision makers in your tribal community, and using that prefix, participate in community coalitions and partnerships, finance public recreation facilities, etc. So providing, these are again the same policy and environment answer choices as you saw before. Providing answers. And moving to the next page. The next page, we see the complete page. Wonderful. And then asking for additional comments before submitting the survey. Again, this is an optional box, but if you have anything to add, I ask you to submit it right there. And then please click the done button just to submit the survey. And again, we only went through at this point the community at large survey in addition to the required about your community survey, but the remaining surveys, click the done button right here. Going back to this, going back to the PowerPoint, as you can see in just one moment. Fantastic. So again, going through, we only went through the first 2 surveys, the required about community and then the community at large. But the remaining 3 surveys, the healthcare sector survey, the school sector survey, and the worksite sector survey, all look very, very similar to the community at large survey, just with specific sector-specific questions, but much of the same applies as we went through. But again, if you have any questions when completing the surveys, do not at all hesitate to contact me. My contact information is on those surveys, and we do wish you luck in completing the surveys. And I'm going to turn this back over to Virginia, the program manager. Thank you so much.
Thank you, Andrew and Consuelo, both. I'm going to unmute you and just kind of go over a couple of last things, underscore and highlight some of the areas that they've already touched on, one of which is the tribal community team. And I want to show you our program website. Andrew referred to it several times. You were able to see where you can find items and documents. Just know that our website, it's cribacorns.org, is a living website, and its main focus is to provide information to you as grantees. This isn't a promotional website. It's really a mechanism for which we can provide you material. We do travel a lot on site visits. Consuelo is most always here, our home-based staff. But if there is something that you need, please check the website if you're not able to get in touch with us. Generally, they are right there. I wanted to show you where you can find the PDFs. So under funding opportunities, community assessment, under the change tool guide, Andrew has PDF'd all of these surveys for you, and he mentioned that. So if you wanted to provide your community at large survey to your tribal community team, you could download it here. And it gives you an opportunity to see the entire survey without having to give answers and click forward. So you can print it out ahead of time and think about some of the questions and how you might answer them. One of the things I want to mention is the questions can be difficult and can be subjective. I have had an opportunity to sit with the tribal community team as they answered the questions. So for example, under physical activity, where it asks, provide public recreation facilities. The 3 of us staff in the room, we all live in different areas of Sacramento, and so if we were talking about Sacramento as their community, we each might provide a different answer on how we feel our access to public recreational facilities are. And that definitely comes up in a tribal community team where people might think everything's in place, it's done, and then you might have a tribal community member who says, actually I wouldn't say everything's in place, I would say some is in place. And then the team is able to have a discussion on where you'll answer, how you'll answer that. If you'll say everything's in place, some in place, few in place, and as a team you'll have to decide what's your decision-making process. One person can't always be the only voice in the survey. You have to decide, will we continue to discuss it and build consensus? Will we take a vote? How will we decide how we'll answer these questions? There are some communities who one person is the lead on the survey, and they'll call folks, and they'll do like little interviews or ask them really specific questions as they move forward in the survey. There's no absolute right way or absolute wrong way of doing the surveys. We provided recommendations early on in this presentation about having your tribal community team, providing everyone a PDF so they can see the entire survey and have an opportunity in advance to think about how they might answer them. But those are just recommendations. I do encourage you, though, to preview all of these questions in advance. Don't just sit down and have the questions hit you one by one. Give yourself an opportunity to have read them all, and that'll give you an opportunity to ask Andrew questions in advance. Like some folks have not are not familiar with what a mixed land use plan is. So that's something you could give us a call and ask, you know, I'm not understanding this question. I haven't heard this term before. We have a lot of resources at our fingertips. We are not the original authors of this tool. This was a tool developed by CDC called the Change Tool. We have adapted it in a number of ways. Andrew has adapted the questions so that they flow a little smoother, so the questions make sense as you go through them one by one. One of the largest adaptations we've made is to move this to SurveyMonkey. The original version of the change tool has you answering these questions in an Excel sheet, and we didn't feel like that was very user-friendly. But if you Google the change tool on our website, you can see the original change tool guidebook. We used to give it to our grantees, but it can be really confusing because we're not using all of those same steps and we're not using the same tool, and it just becomes a confusing issue. But you can look at it if you want. Those are just the couple of things I wanted to underscore. Are there questions from you at this point?